Welcome friends, this is Dr. Vinay Bavkar from Knowledge and Entertainment. Guys, today we are going to talk about common rainy season diseases, a very interesting topic. Come on guys, let's start. Friends, this video is for informational purpose only and should not be used as a replacement for expert medical advice. Friends, the most common rainy season diseases are cholera, hepatitis A, typhoid fever, influenza, leptospirosis, dengue and malaria. The first important disease is cholera. The signs of cholera are sudden onset of frequent painless watery stools, vomiting, rapid dehydration, that is sunken eyeballs, wrinkled and dry skin. Prevention can be done via drink safe and clean water only. If unsure, boil drinking water. Upon reaching boiling point, extend boiling for 3 or more minutes. You may also do water chlorination. A World Health Organization pre-qualified oral cholera vaccine is available for travelers and people in endemic areas. It is given in 2 doses and offers protection for years. Friends, the second disease is hepatitis A. It is a virus that may be transferred from one person to another through the ingestion of food contaminated with human waste and urine of those who are already sick of hepatitis A. Signs include fever, flu-like symptoms, that is weakness, muscle and joint aches, loss of appetite, dizziness, with or without vomiting, abdominal discomfort. After a few days, jaundice may follow. Prevention can be done through wash hands after using the toilet, before preparing food and before eating. Dispose human waste properly. The disease is self-limiting and may last for 1 to 2 weeks. Patient often recovers even without treatment. Friends, the next disease is typhoid fever. An infectious disease, also known as enteric fever or just typhoid, that spreads through contaminated food and water or through close contact with someone who is infected. Signs of typhoid fever include sustained high fever, headache, malaise, anorexia, that is loss of appetite, either diarrhea or constipation, and abdominal discomfort. Prevention can be done by avoid drinking untreated water. Boil water for drinking. Upon reaching boiling point, extend boiling for 2 or more minutes. Or do water chlorination. Cook food well and always cover food to prevent contamination from flies and other insects. Avoid eating unsanitary street vended foods. Wash hands with soap and water after using the toilet and before eating. Get immunized with WHO pre-qualified oral or injectable vaccines. Friends, the fourth disease is influenza, a viral infection that attacks the respiratory system. It is transmitted through contact with a person who coughs or sneezes, or with surfaces, material and clothing contaminated with the discharges of an infected person. Signs include fever of at least 38 degrees centigrade, headache, runny nose, sore throat, cough, muscle or joint pains. Prevention can be done by avoid crowded places, cover mouth and nose with sneezing and coughing, wash hands frequently, annual flu vaccine, minimize contact and distance yourself by at least 1 meter from infected people. Friends, leptospirosis is fifth common rainy season disease. A bacterial infection transmitted when urine and feces of infected animals such as rodents contaminate the soil, water and vegetation. A person may get leptospirosis by ingesting contaminated food or water, when broken skin and open wounds, or when eyes, nose, sinuses and mouth come in contact with contaminated water, usually flood water or soil. Incubation period of bacteria is 7 to 10 days. Signs include fever, muscle pain, headache, calf muscle pain and reddish eyes. For severe cases, liver, brain involvement or kidney failure. Yellowish body discoloration, dark colored urine, light stools, low urine output, severe headache. Prevention can be done by avoid swimming or wading in flood water. Use boots and gloves. Drain potentially contaminated water. Control rodents in the household by using rat traps or rat poison. Friends, the next disease is dengue, a disease common in tropical and subtropical countries in the world like Philippines. Dengue is transmitted through a bite of an Aedes mosquito. According to WHO, dengue fever is potentially fatal and mainly affects children. The signs of dengue include flu-like illness, sudden onset of fever, headache, skin rash, muscle and joint pain, nausea and vomiting, and in severe cases, hemorrhage. Prevention can be done by cover water drums and water pails at all times to prevent mosquitoes from breeding. Replace water in flower vases once a week. Clean all water containers once a week. Scrub the sides well to remove eggs of mosquitoes sticking to the sides. Clean gutters of leaves and debris so that rainwater will not collect as breeding places of mosquitoes. Friends, last but not the least, malaria is common rainy season disease. Caused by the Plasmodium parasite, is spread by the night time dusk to dawn biting female Anopheles mosquito. The mosquitoes don't hum and don't create a welt at the site of the bite, so a person does not know that they have been bitten. This preventable disease affects more than 200 million people worldwide and kills 430,000 people, mostly children. Of the 5 species of human malaria parasites, Plasmodium falciparum is the most dangerous. The other types of malaria are caused by Plasmodium vivax, Plasmodium ovale, Plasmodium malariae and Plasmodium knowlesi. The symptoms include malaria infections are characterized by fever, headache, muscle ache, chills, fatigue and vomiting. Symptoms appearing 3 to 7 days, weeks or up to several months after being bitten by an infected mosquito. In cases with P. vivax and P. ovale, relapses may occur weeks or months after being infected. P. falciparum symptoms are more severe and include behavioral changes, confusion, seizures, anemia, respiratory failure, kidney failure, coma and shock. If not treated immediately, P. falciparum malaria can lead to death. Treatment includes artemisinin in combination therapy, that is ACT, and supportive care of symptoms. Friends, I hope you like the presentation on common rainy season diseases. If you wish to watch such kind of more videos, please subscribe to my channel. The name of my channel is Knowledge and Entertainment. Please do that. Take care guys. Goodbye.